अभी रिकॉर्डिंग चालू हो गया.
Okay, sir.
Just 1 second. I am getting a phone call. Hello.
Yes.
Okay. ठीक है ठीक है. Okay. हाँ हाँ हाँ. So you all can see the screen, na?
Yes,
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 sir.
Okay. So see, basically HIV में कैसा है ना? A lot of things uh, which we have to think differently in HIV. We can't do the normal thinking that we do in any other field of medicine. The usual principles of medicine can sometimes be broken or should be broken in the HIV patient. Huh? So let's get into it with that in mind. Okay. So basically, uh, in HIV, there are various stages, right? So stage
yes,
1 to stage 4, as the patient is worsening, he is going from stage 1 to stage 4. Barabar?
yes, sir.
Hmm?
Yes, sir.
And as he's going from stage 1 to stage 4, his CD4 is going down. CD4 is the main T helper cell, which is actually the backbone of our immunity, our adaptive immune system, right? So HIV targets the CD4 and multiplies in the CD4 and brings it down after few years, few months of getting inside the body, right? So as the patient is going from stage 1 to stage 4, he gets more and more susceptible to more and more infections. Barabar?
Yes, sir.
Hmm?
Yes,
So if there is a patient with a stage 1 HIV, so his CD4 is actually normal. Barabar?
yes,
So
yes,
if we ask what are the infections that the stage 1 HIV patient is susceptible to, right? The patient is
yes,
susceptible to the same infections that a normal person is susceptible to. There is no difference. Barabar? Then as the patient enters the stage 2, stage 3, stage 4, then he is more and more susceptible to opportunistic infections, which will not affect a normal person with a normal immunity. Barabar? Hmm?
yes, sir.
So now how to remember this in an easier manner? Huh? So see, as the immunity reduces and gets completely knocked out, the patient will get affected by the less virulent organisms also. The organisms which are not powerful enough to cause any disease in a normal person.
Yes,
बराबर.
sir. Yes.
तो वो वाले germs, वो वाले microorganisms will get more and more. They can come in the differential. Whereas, which are the organisms which will cause the infection at a good CD4? The organisms which will cause infection at a good CD4 will be the ones which are very virulent and powerful in general. Means they can cause infection in a normal person also. Barabar? Hmm? So now we have seen so many patients with a TB, so many patients with a herpes zoster, even without an immune compromise, right? And bacterial infections, right? So all these things can happen at a good CD4 also, right?
Yes, sir.
These are more virulent organisms, more capable of causing disease, even in a person with a normal immunity. Then as we go lower and lower into the stages, stage 3, stage 4, then we come to more opportunistic infections, right? So you have to think in this way, ठीक है, कि suppose there is a person now, he contracts HIV right now, right? तो पहले उसको acute HIV syndrome हो सकता है. Acute HIV syndrome में क्या होएगा? Viral load will be very high, but CD4 will be okay because the virus has just started entering the body and the CD4. So CD4 may not be low at that time. बराबर. CD4 कम होने को बहुत टाइम लगता है. It happens in stage 2, stage 3, stage 4, which may occur months to years after the initial infection. बराबर. So in acute HIV, viral load will be very high, CD4 will be normal. Huh? Then what happens is over the next few weeks, few months, body tries to control the virus. Huh? And there is a big battle going on between the immune system and the virus.
Yes.
So now, after the initial high viral load, the body brings down the viral load as much as it can. So after a
Yes.
few weeks, few months, there comes a level of viral load that is called as a viral set point.
That's it.
It's called as a viral set point. Okay. So now this viral set point, उसका जो नंबर है, जो लेवल पे वो सेट होएगा, that kind of determines कि कितना rapidly एक पेशेंट का स्टेजेस आगे का आएगा. बराबर.
जल्दी आएगा.
सपोज इनिशियल acute HIV के बाद में somebody has mounted a good immune response and the viral load has come down. So the viral set point is suppose 1 lakh copies per ml. बराबर. So his progress to stage 2, stage 3 and stage 4 will be relatively slower compared to a person whose viral set point is 2 lakh copies. So patient A has a viral set point of 1 lakh copies. So he will start exhibiting stage 3 after 6 months. Barabar. Whereas patient B who has a viral set point of 2 lakh copies, he will start exhibiting signs of stage 3 within 3 months rather than the 6 months which was there in the first patient. Are you understanding?
Yes, sir.
So see, everything is like set and like mathematical. Quite a few things are mathematical in HIV. Okay. So can we make an analogy here where we say, right, that a person who catches HIV, he is like a train. The train is going to go to the various stations or stages. The speed of the train is determined by the viral set point. Barabar. And the stations are your CD4 counts. ये सब सेट है, इसमें कोई सरप्राइजिंग बात है ही नहीं इसमें. You understand? So basically, if you sit on the central line, तो मुलुंड स्टेशन पे तुम्हें अच्छा वड़ा पाव मिलता है, मतलब मिलता ही है, उसमें कोई डाउट ही नहीं. अंडरस्टूड. सेम वे HIV पेशेंट है, उसका CD4 200 के नीचे गया तो उसको ये सारे इन्फेक्शन हो ही सकते हैं, उसमें कोई डाउट ही नहीं. और उसका CD4 200 के ऊपर है तो उसको ये सारे इन्फेक्शन नहीं होंगे, उसमें कुछ सरप्राइजिंग नहीं. It is all very easy and calculated and simple. Some things will happen at some CD4 and some things cannot happen at some other CD4. Okay, it is very simple and calculable. Right? So somebody has come with a normal CD4 huh? And has come with a maybe a peripheral neuropathy or something like that. So I should not think of CMV polyneuropathy. CMV will not occur at that CD4.
Yes.
Understood? For CMV to occur, the CD4 needs to be less than 50, means patient needs to be in stage 4. अभी तक वो स्टेशन पे पहुंचा ही नहीं है पेशेंट, तो हो नहीं सकता है बराबर. So the viral load determines the speed of the train or the speed of the progress to the various stages of that patient. Whereas the stations of the train are the stages of HIV, which determine what are the opportunistic infections possible at what station or what stage. Barabar?
Yes, sir.
Okay. So this is one of the most important things you need to understand about HIV. इस ये बात तुम्हें समझ गई ना, तो बहुत सारी चीजें बहुत सिंपल, लॉजिकल, सिंपल हो जाएंगे. ओके. So another statement that is very common and very important to understand is that differential diagnosis in a patient with HIV is CD4 dependent. Barabar.
About
Patient has come
infections.
with lung infection, lung infiltrates. It can be 10,000 things. Which one it is depends on the CD4. Barabar. Patient has come with a CD4 of 550, which is a normal CD4, and has come with a upper lobe infiltrate. So we are going to think of
TB.
TB. We are not going to think of PCP or a CMV or anything like that, or a MAC. Barabar. Patient has come with bilateral infiltrates and has CD4 of 30. Now all things are possible, including TB, MAC, PCP, CMV. Barabar.
Yes.
So differential diagnosis in HIV is CD4 dependent. Always remember, never forget. Okay. So one thing you must also understand from this table is that some of the infections can happen at a good CD4. Barabar. But if those infections are happening in an apparently normal person, that can be a hint to you that, okay, this person should be tested for HIV. बराबर. So TB patient है, herpes zoster patient है, not at the extremes of age, Bell's palsy हुआ है किसी को, you must test for HIV. The patient will be reluctant to convince him and do it because it is a chance for you to pick up HIV in an early stage, right? To pick up HIV when the person's CD4 is 5 or 10 is no fun. तभी even despite your best efforts, you may not be able to salvage the patient. Whereas if you pick him up at stage 1 or stage 2, you are doing a great thing because ART is very, very effective. Antiretroviral therapy is very, very effective and safe nowadays. Okay. If you start ART at stage 1 or stage 2 of disease, then the mortality of HIV has come down to almost 0. Means person's lifespan becomes a normal person का जो lifespan होता है उतना ही, बहुत ज्यादा कोई फर्क नहीं होता है. You understood? So that is why it's very important to pick up HIV early if it is there. That is why it's actually, if you pick it up during acute HIV syndrome, it's even better. But acute HIV के बारे में सोचना आसान नहीं है, but I'll tell you the hints later. So you got this concept basically. So TB, herpes zoster, rarely cryptococcus, and bacterial pathogens. These can happen at any CD4, even at a good CD4. When you go to CD4 less than 200, then you start getting the more opportunistic infections, including PCP, toxoplasmosis, esophageal candida, cryptosporidiosis, cryptococcal meningitis, and all of the others can also be there from the previous column. When the CD4 falls below 50, then you can get two more additional ones which you don't get in a better CD4. That is a CMV. You can get the CMV retinitis. You can get CMV colitis. You can get CMV encephalitis. Many forms of CMV you can get when the CD4 falls below 50. And additionally, you can also get a disseminated Mycobacterium avium intracellulare complex infections, which can be a disseminated infection or a lung infection. So now, since we know that it is all mathematical and some things happen at some CD4 and not at the other CD4s, right? Your prophylaxis also becomes simple. Suppose somebody has come with a CD4 of 500. So normal CD4 is any CD4 above 400, 450 is a normal CD4. Okay. Patient is HIV positive and has come with a CD4 of 550. You are starting him on ART. Do you need to give him any prophylaxis?
No, sir.
Should
Follow?
we be working them up for TB in this case?
And all that workup has come negative when you are starting ART. Right now,
Oh,
it doesn't have any opportunistic infections.
right, sir.
He's at a good CD4. So, do we need to give him any prophylaxis or no?
No, sir. No, sir.
No prophylaxis? Sure?
We should educate the patient about the hygiene and prevention from wearing masks.
Herpes zoster से prophylaxis देना है नहीं देना है?
His risk is the same as a normal immunocompetent individual at this CD.
Hmm.
So he should not
Okay.
require a prophylaxis for that.
Yes, you are right. So at this CD4, you don't need any prophylaxis. You should not start any prophylaxis. Plus, you are starting the ART. So
Yeah,
ART से आपका जो भी है सब immune reconstitute भी हो जाएगा. जितना भी कम हुआ है तो आगे कोई चांस ही नहीं है फिर. Whatever. Now Zoom just told me that my meeting is ending in 10 minutes, but I think we can restart also, no? New one.
Yes.
वो
Yeah,
कुछ
yeah,
yes.
40 minutes चलता है ना ऐसा.
वो टाइम एक्सटेंड करना पड़ेगा वो एक्चुअली लेट टाइम लिमिट रहता है 40-45.
Yeah. So I will restart the meeting and send another one. Don't worry. But by 9 minutes में अपना ये meeting खत्म होएगा. We'll restart again. Don't worry.
Yes.
Okay.
So when the CD4 starts falling below 200, now do you want to give any prophylaxis?
Yes, now the patient will require prophylaxis for PCP,
What will you
uh,
use and for what? Bugs.
for PCP we can use Cotrim
Trimethotrexate
treatment.
for PCP.
Okay. What dose will you use in prophylaxis?
a single strength we use.
Single strength BD
BD.
or double strength OD?
A single strength OD at night time.
Single strength OD.
Night time.
How much is the power of single strength?
Diameter का 80 80 बाय diameter का 80 रहता है. Quaternion oxide का
2000
Double strength.
160
हाँ,
रहता है.
so 80 dimethyl and quaternion oxide का
480 होता है. Single strength tablet is 480. 400 plus 80.
400
400.
And double strength tablet is 960. It is 800 and 160. Barabar? Don't forget these are small simple things. Okay. So usually we give double strength tablet in the afternoon.
Okay, sir.
So this will protect against what all bugs? Trimethoprim sulfamethoxazole will protect against which opportunistic infections?
pneumocystis.
PCP.
PCP.
PCP. What else? अरे बोलो यार. It protects against toxo also, na?
हाँ, toxo है.
Toxo का treatment is similar, sulfadiazine pyrimethamine, na? So Bactrim will protect against PCP and toxo. It protects somewhat against crypto also, cryptosporidia, not cryptococcus. So many of the GI pathogens also kind of protects. Barabar?
Yes, sir.
And what other prophylaxis you will use?
Sir, fluconazole for cryptococcal
Yeah,
meningitis.
fluconazole you can use to prevent esophageal candida. The fluconazole will also help against the cryptococcal meningitis prevention. Okay. So when the CD4 falls below 50, is there any additional other prophylaxis you will use?
CMV retinitis.
What will you use for that?
Sir, for MAC, we can use rifampicin, erythromycin. Sir, for disseminated Mycobacterium avium, we can use rifampicin.
Rifampicin you want to use? Prevention? रिफैम्पिसिन अकेले यूज किया तो प्रॉब्लम है ना अपने देश में.
Resistance. Mono.
हाँ, means even if there is no TB right now, if later on patient develops TB, then that will be resistant to your been problem, no? So basically you have to use macrolide for MAC prevention. So usually we give azithromycin 1 gram once a week. Azithromycin has a very long duration of action, so it stays in the system for a long time. So we can use it like that. CMV के लिए you want to use something for prevention? What is the drug we use for CMV? हाँ बोलो. Yeah. What is the drug we use for CMV?
Ganciclovir.
So ganciclovir can we use for prophylaxis?
We use it for treatment, sir. I'm not sure about the prophylaxis part.
तो prophylaxis के लिए क्या use करेंगे? हम transplant recipient में देते हैं ना valganciclovir. That is for prevention only, na? So we can use valganciclovir, na, for prevention.
Yes.
Oral valganciclovir we can use. We don't use. Why don't we use? In HIV, valgan prophylaxis is not recommended below CD4 of 50. You understood?
Yes, sir.
Because incidence is not so common.
Okay.
Whereas in the post-transplant patient, valgan CMV infection अगर किसी को हो गया तो the risk is too high because the patient will develop graft rejection and other life-threatening infections, like lung infection. So prophylaxis with valganciclovir or ganciclovir is not recommended in an HIV patient with a CD4 less than 50. बराबर?
Yes.
So you have understood this much now?
Yes, sir.
So HIV is like a train, and the stages are your CD4 counts at particular stages. And the speed is determined by the viral load, the viral set point. And at certain stages, you will get certain infections. At other stages, you will not get other infections. Barabar?
Yes.
So as we move towards the right, the number of diagnostic possibilities tend to increase substantially. But remember this also. A patient with CD4 of 30, it doesn't mean that he cannot have TB. Barabar?